want to make sure that they're stable hemodynamically. You're going to assess their airway, you're going to control their blood pressure, and if there's considerable pain, you can use short-acting medications like fentanyl to try and control their pain. But once they're stable, it's important that you get them off to the CT as quickly as possible. Blood pressure control is really one important step to reduce the risk of rebleeding before the aneurysm is secured. Now, even pain control may sometimes be sufficient to control the blood pressure, but if it is not, then we want to look to using short-acting medications like labetalol and hydralazine. And if it's refractory to those medications, then you can consider infusions with a calcium channel blocker like nicardipine. We want to stay away from venodilators, just as Dr. Ayagari had mentioned. Nitroglycerin, nitroprusside, those are ones that can dilate the venous system and elevate your intracranial pressure. If a patient has acute hydrocephalus, we are going to want to avoid overtreating the blood pressure because they have to maintain a cerebral perfusion while they may have potentially elevated ICPs. So in those particular cases, we're going to want to look to get the ventricular drain in before we start to manage the blood pressure more aggressively. After the aneurysm is secured, though, this is when our blood pressure goals can be more liberalized. The preferred diagnostic procedure is the non-contrast CT. In the first 12 hours, blood will be